Hello, everyone. Thank you for joining us today for our webinar entitled Decrypting the Security Risk Assessment Requirement for Meaningful Use. Today's presenter is Andy Petrovich, MCEDA Health IT Security Specialist. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's presentation. If you have a question for Andy, please type it into the questions box in your GoToWebinar interface. We'll take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. We will also be posting the presentation slides and a recording of today's webinar on our website, www.mceda.org. Hover on the Resources tab and then select Webinars. The information you will hear in this broadcast is current as of today and is only intended to be a general summary. Since Medicare and Medicaid policies change frequently, the best way to stay up to date on current requirements is to review the actual written law or regulations. We encourage participants to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. Today's agenda is fairly short. We will start out by giving you a brief overview of MCEDA and our various recently expanded service offerings. Following that, Andy will take over and provide an in-depth overview of what eligible professionals and their teams need to know now about the security risk assessment in order to achieve meaningful use in 2016 and 2017. At the end of this presentation, Andy will take some time to answer your questions and regarding the security risk assessment. Housed within Alterum Institute, we are MCEDA, the Michigan Center for Effective IT Adoption. Originally born out of ARA and more specifically the HITECH Act, MCEDA is Michigan's regional extension center, tasked by the federal and state governments with accelerating the selection, adoption, and meaningful use of health information technology to improve the quality and efficiency of healthcare in our state. To date, we have assisted over 5,700 providers across Michigan, impacting 1.6 million patients annually. 1 out of 4 Michigan providers who received a meaningful use incentive payment did so under MCEDA's expert guidance. Ranked as the 5th largest REC out of a national network of 62, we are now also funded by the state of Michigan to assist providers in the Medicaid EHR incentive program. MCEDA's health IT services include the following. Number 1, meaningful use support at any stage and year. We are here to support providers in either the Medicare or Medicaid EHR incentive programs, but providers participating in the Medicaid program also benefit greatly by qualifying for state-subsidized services. As a result of the recently announced modified Stage 2 2015 changes, MCEDA has developed a streamlined service for Medicare-eligible professionals. The MCS Express service provides targeted technical assistance on these changes, an assessment of your current state, and, if eligible, the remaining steps to prepare for 2016 attestation. Number 2, security risk assessment, which is an embedded service within our meaningful use support. But if providers have meaningful use handled and only need assistance with the SRA, standalone service. Number 3, attestation and audit preparation. If you are getting ready to attest to meaningful use and just need some peace of mind that you've crossed all the T's and dotted all the I's, or if you're one of the many folks who have been selected for a meaningful use audit and need assistance responding, we are here to help. Number 4, targeted process optimization, or TPO, takes a stripped-down version of lean principles and applies them to any clinical or operational practice improvement initiative. No matter what you need help with improving in your practice or clinic, we have experts on hand who can assist you. Number 5, we have just recently added a new service line supporting providers in the PQRS program. If you need assistance getting started in this program, or even if you have been participating but need some help with measure selection and reporting options, please give us a call to discuss a quote for services. And number 6, the Great Lakes Practice Transformation Network offers no-cost technical assistance to eligible providers in support of quality improvement initiatives, PQRS support, and preparing for upcoming advanced payment model changes under MACRA MIPS. Contact us to learn more. With that, I will turn things over to Andy.
Thank you, Liz. There's a lot of information and misinformation about security risk assessments and the HIPAA security rule out there. There are even some organizations, agencies, consultants that might spell HIPAA incorrectly. So it's our goal to help you sort through it all by giving an overview of the security assessment requirements and what steps need to be taken for a security risk assessment. The MCDA team is often contacted with questions and concerns such as what is an SRA and why do one? How do I know my SRA, security risk assessment, will stand up to an audit? How does an SRA that meets meaningful use requirements guarantee my practice is HIPAA compliant? The answer is it doesn't. How can a practice act on the results of an SRA? How can an SRA be of value beyond attestation? So our goal here is to answer these questions and more, but of course there's still a great deal we won't be able to cover. So we encourage you to seek out as much information as you can and feel free to reach out to us with any questions you have. Thank you for joining. Risk and security go hand in hand, yin and yang. These are concepts we all have a sense of, but sometimes the notions are not clearly defined. In order to interact with the world around us and obtain value from it, we have to put ourselves at risk. We know that there are risks out there, but we don't want them to stop us from getting out into the world, putting the resources and various value-adding activities to good use. So the question is, how do we ensure or maximize security? And it's a complicated process, but the first step is awareness. You can't account for risks until you're aware of them. Once you're aware of the risks, how you deal with them is a business or personal decision, but the first step has to be awareness, and the purpose of the security risk assessment is to create awareness. Conversations about information security usually revolve around compliance, and rightly so. You want to be on the right side of the law, but the regulations are in place for important reasons, and I like to focus on those in these conversations. Unfortunate things happen to patients' personal information, and there can be serious adverse consequences for the consumers affected. You're not just completing the risk assessment because you have to. You are making an investment to protect your organization's reputation as well as your patient's well-being. So between the law, your organization's reputation, and patient safety, consider for a moment, what is your top priority? Let's take some time to explore information security and its broader implications, starting with patient safety. The Hippocratic Oath states, first, do no harm, and this is a key tenet of the practice of medicine. In 2015 alone, we saw a bit of a landmark in that the total number of medical records breached basically doubled over the past, what was previous 5 years. In 1 year, we saw almost a doubling of the total records breached at 112 million medical records breached in 2015. And each of these represents not just a number, but also a very personal experience for the people involved. Breached medical records can have real, serious consequences for victims. Here's some statistics regarding the costs of breach to the households affected. There are an average of over 12 million identities stolen every year. Now, this doesn't refer to necessarily records being breached, but the actual activation of that breached information in terms of identity theft. And the cost of this is about $5,000 per household, and this cost has been increasing on average every year. And then there are, of course, other concerns when you're dealing with medical data, such as the privacy and stigma of health information. In addition to the personally identifying variables that could be used, the health information itself is of a sensitive nature. And if your credit card is stolen or fraudulently used, your bank can often replenish the lost funds within a few hours. Stolen identity information, you can affect patients' reputations, credit scores, even their taxes, as many fraudulent tax returns can be and have been filed based on stolen information. Medical information can also be used to blackmail high-profile victims of identity theft. Millions of people are affected every year by loss of personal information. The cost can be substantial. With all the news of cybercrime, hacking, and identity theft, the public is increasingly concerned about the security of their information. In a survey published by Health IT Security News, 81% of patients reported being concerned about privacy and security of their data in EHRs, and 60% of patients believe that EHR use will increase loss of information. Patients are like any consumer, they'll vote with their feet, and more data is emerging demonstrating the significant impacts of data breaches on e-commerce. Patients, like any consumer, they do vote with their feet, and a recent survey conducted by FireEye shows the effects of a breach can have a significant impact on how consumers perceive and interact with the organization. One important finding being that 76% of consumers are willing to seek new providers after a breach. Also, consumers are more likely to pursue legal action and less likely to share personal details with the organization. And how might this affect your medical practice? I think you, upon consideration, will find the implications to be far-reaching and deeply impactful. In healthcare, one service we offer, in addition to medicine itself, is giving patients peace of mind. Since patients are uneasy about EHR security clearly and willing to act on their dis-ease, it's important to win their trust by assuring them of your strong security measures, demonstrating how seriously you take their privacy and the security of their information. Another thing to consider is that healthcare breaches are made public, and no one wants to see the name of their clinic in the newspaper or on the Office for Civil Rights Wall of Shame for the wrong reasons, in addition to the implications and impacts on patients. And there are also real-world examples of competing hospitals or healthcare providers using breach information against their competitors in marketing campaigns. Last but not least, let's consider the compliance aspect. Covered entities that suffer a breach and have not performed a security risk assessment or otherwise do not have an effective risk management program face the steepest penalties from the Office for Civil Rights in the event of an enforcement action. This is very consistent across the board, and the penalties can be very steep, and they are also publicly available. You can check them out on the website to see what the cost will be per record breached, depending on if you get that willful neglect, which is what you are likely to have attributed to you in the event of not performing a risk assessment. A lack of or incomplete SRA, or security risk assessment, is the main reason providers fail meaningful use audits as well, resulting rather directly in the loss of their incentive money. And these costs should be considered in addition to extra costs incurred by having ineffective security measures in the first place. If you have a breach, it's expensive to begin with. Breach victims may pursue legal action for damages if they're able to demonstrate such damages. And even if they're not, dealing with a lawsuit is a costly endeavor on its own. Many healthcare providers, in addition to these direct financial repercussions, have incurred costs due to losing access to their data from ransomware attacks. We've seen a spike in this kind of activity in early 2016, where the ransomware type of malware will encrypt all of your data until a ransom is paid. And there are many examples of these unfortunate events occurring, and security pertains to access as well. Good security measures will help ensure that if you are the victim of such an attack, you will be prepared and minimize the losses of the event itself. Health information breaches have been increasing over the years, and the trend is accelerating, with 2015 being called the year of the healthcare breach by many experts in the field. Over the last 6 years, the number of data breaches reported by the healthcare sector has grown at such a rapid rate that it surpassed, some years ago, the retail industry as the leading sector within the United States for data breaches. In 2009, healthcare accounted for only 14% of all data breaches, while retail had 41%. And in 2013, we reached the inflection point where the number of data in healthcare increased to 40% of the total, surpassing the retail sector at the time at 34%. And the trend is only continuing to accelerate as healthcare data becomes more available, and security tends to be relatively low in relation to payment card industry, banking and finance, security systems as well. Another important note here, even though EPHI breaches are increasingly attributed to hacking attacks, with some of the fairly gaudy numbers about the number of medical records being breached discussed previously, due to huge scale exfiltrations from hacking attacks, human behavior is still a crucial factor. So for example, the Anthem hack, which was the largest healthcare breach to date of approximately 80 million medical records, that is a hacking attack, but it was also due to a phishing attack in which somebody clicked on a link in a malicious email, which ultimately resulted in what became that massive medical records breach. So it's important to consider what healthcare providers can do to protect their data going forward. So of course, performing accurate and thorough risk assessments to increase and ultimately maximize awareness of the risks facing the organization. You want to also manage risk continuously. Risk assessment's not a specific or discrete point in time. You want to have an ongoing and continuous risk management process. Another key factor is increasing the use of encryption over time, and experts continue to point to this despite it not being always in place as needed. It is, at this point in time, something that should be standard across the board. Also, you want to train all staff and providers on how to properly protect EPHI. Security is everybody's responsibility, and the security of your clinic or health IT systems are only as strong as the weakest link. And finally, include medical and ancillary devices in your risk assessments. We see indications that this will be of increasing importance, as it's suspected that a number of the ransomware attacks of this year were originating in medical devices that were connected to the network and used to pivot to more critical systems. Also, we are seeing an increase in FDA oversight and regulation of medical device security. So that'll be of increasing importance going forward, and is something you should be sure to be mindful of. With these considerations in mind, let's now discuss the different requirements and definitions in more detail. Let's start with the big picture. The HIPAA security rule is one part of a much larger piece of legislation, the Health Insurance Portability and Accountability Act. The security rule was made law in 2003 with an effective date of 2005. So for one thing, check your binders. If your HIPAA binder is pre-2005, you'll probably want to update it. And by probably, I mean absolutely. That also means the security risk assessments have been required since 2005, but many providers are becoming aware of the security risk assessment requirements and the security rule as a whole because of meaningful use, the requirement to conduct risk assessments. As many of you know, meaningful use requires a security risk assessment be completed as a primary objective. The trend is showing that this objective does not go away with the changes into meaningful use over the years. Rather, it is increasing in importance, and as evidenced by its now being objective 1 as opposed to the 15th out of 15 objectives in the original meaningful use final rules. The security rule states that covered entities, that is to say entities which are covered under the HIPAA requirements, such as medical clinics, health insurance companies, and so on, they are responsible to ensure the security of their patients' protected health information. And protected health information, or electronic protected health information, is any health information, including demographic data, that is individually identifiable and linked to a person's healthcare or medical record. There are a number of steps a covered entity must take to ensure PHI, or protected health information, is secure. These are outlined in the security standards in the security rule. Covered entities must adopt appropriate administrative, physical, and technical safeguards in addition to other security requirements, such as those regarding data sharing and documentation, in order to comply with the security rule. The security risk assessment is the first part of a larger security management process required by HIPAA. Risk assessment requires covered entities to conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of ePHI held by the covered entity. This requires the organization to examine itself from top to bottom in the context of its broader environment. Internal as well as external factors need to be assessed, as well as how they shape each other. Risk management requires covered entities to implement security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level. And that is sort of a mantra that is recurring throughout the security rule. Safeguards need to be reasonable and appropriate. The appropriateness of these security measures is informed by the risk assessment process. Covered entities must apply appropriate sanctions against workforces who fail to comply with the security policies and procedures of the covered entity. That would be the sanction policy bullet point there. And further, implement procedures to regularly review records of information system activity, such as EHR audit logs, access reports, and security incident reports. You want to keep these records on files for 7 years in case they're needed to support your security program during an investigation or audit. Supporting documentation is always requested during an OCR, Office for Civil Rights, breach investigation, so make sure you document everything you're doing. You're already doing the work in terms of these investigations and monitoring activity. Make sure you get credit for it by maintaining that documentation, which is also required. This table expands on some of the requirements of the security rule that are pertinent to a security risk assessment. Physical safeguards pertain to the facility and immediate location of your practice, such as locks on doors, the location of computer hardware inside the office, which personnel have access to it, how you manage access, as well as the integrity of the structure itself. And frankly, physical safeguards are often overlooked in a information security risk assessment, but they are absolutely crucial to performing an accurate and thorough risk assessment. Not only do you need to consider safeguards against malicious actors, such as someone trying to break in to your medical practice or records room or server room, but you also need to consider events that could disrupt access, such as a power failure, fire, burst water pipes near IT equipment, things of that nature. Administrative safeguards cover policies, procedures, job descriptions, and enforcement actions regarding how you are securing ePHI. Basically, how do you govern the protection of ePHI, including the people using your health IT devices and those processing the information. Technical safeguards pertain to software and system configuration. While a security risk assessment is often thought of as a primarily technical exercise, that is a far too limited perspective to really do an accurate and thorough risk assessment. In fact, the technical safeguard aspects are a minority of what a security risk assessment must examine, although certainly they are very important. They do not constitute the entirety of your security risk assessment. Policy and procedure requirements, policies and procedures need to be in place reflecting all the safeguards that you have in place. So in addition to having the safeguard, you have to have a policy outlining what the safeguard is at sort of a high level, potentially even a philosophical level. But then to back those up, you have to have procedural documentation in place demonstrating that your policies and procedures are being followed and enforced, and these need to outline what's happening in greater detail. And an important note is that such documentation can be requested in the event of a HIPAA audit, so make sure your records are accurate and thorough. And lest we forget, there are other organizational requirements such as your breach notification policies and procedures, requirements to have business associate agreements in place with third-party vendors who have access to EPHI. You need to protect your patient's information when it's in the hands of those third-party vendors, and we'll discuss a little bit more about business associates later on in this presentation. So as mentioned, a security risk assessment is a requirement of HIPAA security rule. Also, as I'm sure you're aware, a requirement of meaningful use. The meaningful use objective states protect electronic health information created or maintained by the certified EHR technology through the implementation of appropriate technical capabilities. Now, that language is something that sometimes providers get tripped up on. And we'll discuss later the exact scope and the implications of the scope of your risk assessment, but that is the language of Objective 1. Further detail on how to meet the objective is provided in the measure description, which is to conduct or review a security risk analysis in accordance with the requirements under 45 CFR 164.308A1. That is referring to the specific requirement under the HIPAA security rule to conduct a risk assessment. This includes addressing the security, to include encryption, of EPHI created or maintained by certified EHR technology in accordance with the other two requirements listed right there, and implement security updates as necessary and correct identified security deficiencies as part of its risk management process. There's some key language in there, but one thing you'll want to note is that everything here is pointing to the HIPAA security rule. And also, you do have to not only conduct the risk assessment, but implement security updates as part of the organization's risk management process. So not only do you have to conduct the risk assessment, but it's implied here that you will have a risk management process that is going to be activated to meet this requirement. Conducting a security risk assessment for meaningful use is a crucial first step in a risk management program. For meaningful use, it's important to make sure your security risk assessment is conducted during the year of your reporting period, and most importantly, after the certified EHR technology has been implemented and before attestation. Meaningful use requirement, again, it's pointing to the HIPAA security rule requirements. So be sure you're basing your process on the security rule, and you'll want to be familiar with those other requirements quite thoroughly. While meaningful use requires the security risk assessment be completed each year prior to attestation, the HIPAA security rule is broader, and in order to achieve compliance, you will need to address and meet all of those requirements for the HIPAA security rule. It's important also to note that security impacts patient and family engagements and other measures. For example, to help meet your patient portal requirement, patients who are confident in a practice's information security would probably be more likely to use the patient portal, which, as you might know, is another requirement of meaningful use. And as we've seen earlier, patients do act on their confidence or perceived security of information systems, and they do have concerns about EHRs. So security, once again, not just a single requirement, it is an investment in the practice. But I want to provide a quick note on encryption since it's referenced in the language of meaningful use. It specifically was called out in the 2014 update to the meaningful use measures, and again, more recently in the 2015 final rule, it is given a special place in the requirements. And even though this isn't really adding to the requirements, because if you're doing a risk assessment according to the initial requirements, you would be including encryption, it's being highlighted to demonstrate the importance of encryption, largely due to it being considered technically an addressable specification under the HIPAA security rule. And sometimes this is interpreted as being optional. It's not optional. In fact, under HIPAA, encrypted ePHI is considered secure and therefore protected from a breach. This is called, it's referred to as a safe harbor. So there's one major incentive to have encryption there. If you have a laptop with ePHI stored on the hard drive and it is lost or stolen, if that hard drive is encrypted and the encryption is activated, that information is considered secure. However, if it's not only is the information considered unsecure and therefore most likely a breach, you also will find yourself in some hot water, because if you didn't have that ePHI encrypted per the addressable specification for encryption in the HIPAA security rule, you are going to have a very convincing written, documented explanation of why you chose not to encrypt that particular device or other devices, and what equivalent safeguard you put into place to compensate for the lack of encryption. And to be honest, I always struggle with trying to think of any sort of security safeguard that might be equivalent to encryption that wouldn't effectively be encryption. So the vast majority of organizations are going to find encryption to be the best solution for protecting their information at rest and in transit. As noted, encryption also provides a safe harbor in HIPAA, such that the encrypted PHI lost is not necessarily considered breach as long as that encryption key was also not compromised. So again, don't make sure your encryption is activated by not having, for example, your encryption key on a sticky note taped to the cover of your laptop. Organizations should encrypt ePHI at rest, such as those stored on hard drives or servers, and in transmissions such as secure connections to your hosted EHR or patient portals, which generally should be considered secure. And you can check for that in your web browser to make sure that the security is in place. While the security risk assessment requirement is a small piece of HIPAA, it has raised a number of questions, and to help clarify what a security risk assessment needs to be, the Department of Health and Human Services Office for Civil Rights, generally referred to as OCR, has issued guidance on risk assessments, and this is referred to in the CMS Meaningful Use tip sheets on how to conduct and complete a risk assessment, also including it here for your benefits. The scope of the risk assessment must include all ePHI in an organization. You need to document your data collection and methods for conducting the risk assessment. You need to identify and document anticipated threats and vulnerabilities for your ePHI. You need to assess current security measures in place, then establish the likelihood of a threat occurring and the impact of a threat occurring, and determine from these a level of risk. Then document your completed risk analysis and perform periodic reviews and updates. It's important to note that there's no one way or there's no one-size-fits-all method to perform an SRA, but every method must meet these objectives. So we've been talking a lot about risk, but if we're going to precisely assess it, we need to define it. The following is a paraphrase of the National Institute for Standards and Technology, or NIST, definition, and I'll read it for you. Risk is the potential or likelihood of a negative outcome or impact toward an asset due to a vulnerability being exploited by a threat that would reduce the value of the asset to the organization. So to put it into an example, risk exists when you have a valuable asset that contains some vulnerability, as any asset will, and a threat exists to potentially exploit the vulnerability and diminish some or all of the asset's value. That potential is what we call risk. So as an example, let's say you have a laptop with some ePHI stored on it. Its portability, while certainly useful, presents a vulnerability as well in that it could be more easily misplaced or taken without authorization. A person entrusted with the laptop may leave it sitting out at a coffee shop while they step away for a minute. When they come back, it's gone. So what's happened to that data? Hopefully, it was an encrypted laptop, and you won't have to worry about it quite as much. And it's useful to think about exactly what is being protected. So we're talking about the data on the laptop. We want to protect it. A lot of it's very intuitive and very obvious, but let's drill down a little more. What is the value of protected health information? The targeting of protected health information by hackers and other malicious actors indicates its value as an illicit commodity traded among criminals. It's fetching a higher price these days than credit card information. Let's consider the value of ePHI when it's being used legitimately to help us understand its importance, and this will help us define security. So the security rule requires that we protect the confidentiality, integrity, and availability of ePHI. These variables determine the value of the ePHI itself. When one or more of these variables are compromised, the value is reduced. Confidentiality means basically that you can't get to the information unless you're supposed to. The information is kept private and used appropriately. When this is compromised, the very identity of the patient in front of you could be in question, among other potential harms. You can certainly consider the implications of that. Integrity means the ePHI is accurate, complete, and up to date. If a patient's chart says do not resuscitate or no medical or no allergies to medicine, you need to be able to trust that those statements are accurate in order to get the most value out of your information. And finally, availability means that the ePHI can be accessed when needed. If you can't have the information when it is needed, your ability to administer quality care is impeded. Yet the availability of protected health information always presents vulnerability. Every system, every asset has some kind of vulnerability. It's really unavoidable, and you need to be aware of vulnerabilities and come up with ways to protect the asset while still being able to meaningfully use it. I like to use the example of considering the gold in a vault. If the gold were completely sealed off, there'd be no way to access it. So then what would really be the value of the gold itself? So you create access by installing a door, in this case a very thoroughly secured door, but the door, the presence of it as secure as it may be, does present a vulnerability and it presents an access point. So controls are all about making your figurative door as difficult to get through as possible without authentication, which will allow us to get the value out of the asset. So authentication is a barrier you can only get through if you're supposed to. In a healthcare setting, controls to protect patient information exist in the form of locking doors, separating the waiting room from care areas, monitoring traffic on your network with firewalls or your EHR activity log, and of course training staff on how to properly process and transmit PHI, among other examples. It's also important to consider the relative value of the assets and the need for timely access. So controls, it's very appropriate and important to have controls vary in flexibility. For example, it takes fewer authentication steps to get money from an ATM machine than it does to draw out of a trust fund. Similarly, an EHR server should have stronger security around it than an email server. In addition to how you're securing, you can take these considerations in terms of how you secure the information in your practice, such as the information you're processing at the front desk versus information that is being permanently logged into the medical record. So going back to the vault analogy, not all the money is kept in the vault all the time, and the vault is not always being accessed to gain smaller sums of money. Smaller sums are kept at the front desk with the tellers who are able to provide it as needed due to the increased demand and smaller sums being processed. So now that we've considered vulnerabilities, let's talk about threats. Here's a question to ponder. Do the majority of breaches originate from an internal or external source? At this point in time, it's a bit of a muddy question. It used to be a pretty easy question to answer in that it was internal sources. At this point, though, what we see more and more are internal sources being exploited by external actors. But the moral of the story is, at the end of the day, internal factors play the most crucial role in securing your information. The majority of breach incidents at one point do originate from an internal source, and lack of awareness due to improper personal training, users bypassing the organization's requirements by using unauthorized devices and programs for official business, such as also referred to as shadow IT, and then lack of enforcement of policies and procedures, also malicious or disgruntled employees or insiders are common root causes of these breaches. As noted, hacking and external threats are on the rise, and while recent breaches appearing to have involved malicious outsiders have resulted in the largest numbers of records breached, most incidents are smaller in scale and result from the internal factors referred to previously. It's also important to consider potential threats in the external environment, such as natural disasters, infrastructure failures. How is your organization prepared to maintain secure access to PHI in the event of, for example, a regional 3-day power outage? Also consider, especially in light of business associates being included in the chain of liability for a HIPAA breach, the overlap between internal and external sources. And right at the middle of the Venn diagram there, you will see business associates. Business associates are technically outsiders, but by being granted access to your ePHI, they have insider access, and how you manage the risk of those business associates needs to be tailored accordingly. So let's talk a little bit more about business associates. Business associates are vendors who work with HIPAA-covered entities to store, process, transmit ePHI. Any of those kinds of interactions will make a vendor a business associate, and they are required by HIPAA to sign business associate agreements, though it is the covered entity's responsibility to make sure that those business associate agreements are in place. The business associate agreement formally extends HIPAA requirements for safeguarding protected health information to the vendors who would otherwise not be covered by HIPAA. While the agreements are required, it should be noted that business associates are defined by their relationship to covered entities and are legally subject to those HIPAA requirements by virtue of that relationship, even if the business associate agreement is not in place. If the agreement is not in place, that's simply adding to the vulnerability or risk that the covered entity is facing and should be addressed as soon as humanly possible. So business associates present serious ramifications regarding the confidentiality, integrity, and availability of ePHI due to their access. Many breaches are due to business associates. The figures I had seen most recently were between 20 and 30%, and that is a pretty normal, steady rate. In addition to breaches, there are also issues of access. For example, disputes regarding contract terms or payment for services for vendors hosting data. Things like that can result in providers losing access to their information, which is also a security concern in addition to the breach considerations. A prominent example is a situation in Maine where a rural health clinic had an EHR vendor which was purchased by a larger company. Payment rates increased. The clinic could make the payments, and their access to the data in the EHR was terminated. Another consideration is regarding a recent exchange between a health information exchange in Illinois and their data hosting vendor, and whether or not they would be given sufficient time to verify the integrity of data as the service is transferred from one data hosting vendor to another. These are considerations that you are best served to iron out as you are initiating the contract, and your business associate agreement is one place where those can be fleshed out in writing. We've discussed malicious outsiders and insiders as threats, but what if you have a malicious business associate that is, in effect, both an outsider and an insider? A classic example here is that of Edward Snowden, who was a contractor for the National Security Agency with insider access to very confidential information. So how can you make sure your sensitive information is secure in the hands of a business associate? Well, there's really no way to be 100% sure, and that's sort of the nature of risk. But one thing you can do to increase or maximize your security is to make sure you vet all potential vendors before you sign your agreements with them. The more information you can get about their security posture, the better. Good vendor management, once those agreements are signed, is also key. Have frank discussions with your business associates about information security. They need to be taking the security of your patient's information just as seriously as you do. Do they have written information security policies and procedures? Are they conducting risk assessments? Are their safeguards reasonable and appropriate? Do you think that your business associates would pass a HIPAA audit? Well, they might have to, and if the answer is no to any of these questions, that business associate relationship could present a greater risk to your organization than is necessary. So speaking of audits, the Office for Civil Rights has said for several years now that they will be starting a random audit program for covered entities and business associates, and it finally looks like that's underway now in 2016. Originally, the program was set to launch in 2014. It was delayed a few times over. The audits are assessing organizations' compliance with HIPAA security, privacy, and breach notification rules, and these will be assessed through on-site and remote audits. As said before, business associates are covered under this audit program, and it's important to note that if business associates are audited, it could reveal a security issue linked to your organization. Another important note is during the pilot audit program, the security deficiencies identified from that span of time in 2012 to 2013 were a lack of or incomplete SRA and a lack of awareness about security rule requirements. So there's a lot of talk about audits. There are meaningful use audits, there are HIPAA audits. To avoid confusion between meaningful use and the HIPAA audits, let's clarify what that difference exactly is. Meaningful use audits are conducted by a firm under contract with CMS and will occur for a larger number of practices, purportedly 10% of providers who attest to meaningful use in any given year. These audits are random, but if a provider fails an audit one year, they will most likely be audited the following year as well. The meaningful use audit covers all of the measures and reported figures, which includes the SRA requirements. As this is only one part of the meaningful use audit, the investigation into your security risk assessment is focused on a few key variables, namely proper timing of the SRA, proper scope of the SRA, and then your ongoing remediation of identified risks from the previous year, if it's not the provider's first year of meaningful use, of course. Certain other security activities can also be examined. Namely, I've heard examples of EHR audit logs, the review of those audit logs, and proof that those audit logs being reviewed, that those need to be provided to Figliazzi and Company, the auditors under certain circumstances, as well as documentation supporting vulnerability assessments that are being conducted. Basically, if you say in your corrective action plan and your ongoing mitigation of the identified risks that any given identified risk or security concern is being identified, be prepared to demonstrate how you are identifying that in the following year in the event of a meaningful use audit. Now, it should be noted that some of the details in the previous description apply to the Medicare EHR incentive program. The Medicaid EHR incentive programs, the audits for those are being administered through the states. So you want to check with your state's local resources to see how they're handling meaningful use audits. As for HIPAA audits, these are focused exclusively on one of the 3 administrative rules under HIPAA, the security rule, the privacy rule, or the breach notification rule. They're going to be more focused in scope than the meaningful use audits, which are rather broad. These are going to be really drilling down into, for example, if it's a security rule audit, they're going to be looking at your security rule policies and procedures, not just the risk assessment and ongoing mitigation plan. Again, all covered entities and business associates have a chance at being audited under the HIPAA audit program, but it is going to be likely a smaller number than the number of providers who have been and are being audited for meaningful use. It should also be noted that in addition to the random audits, the majority of Officer of Civil Rights investigations to date have occurred following a breach or potentially a complaint to the OCR hotline. So with that discussion behind us about the requirements and definitions, let's get into how the security risk assessment is performed. The Office of Civil Rights emphasizes time and again the primary importance of conducting a risk assessment. So let's review the exact steps of a security risk assessment process. Again, we're going to look at the NIST guidelines in a slightly different angle. The first step is to identify and classify your assets. So this would be all assets in your organization, and you should also then classify which assets process, store, transmit, or maintain protected health information versus those that do not. And then within that asset classification, some of those are going to be more critical than others. For example, your backup drives versus your server, if you have a server on site, versus your workstations, versus your portable devices. All of them are going to have a different security profile, and it's important to parse that out up front with your risk assessment process so that you can properly account for the different vulnerabilities that each possess and the different threats presented to each type of asset. The second step is to identify and classify your threats and vulnerabilities. So these are going to exist in a number of ways, and also, while there are some, certainly, that can be quite generic, every organization, depending on the circumstances of its operation, are going to have unique threats and vulnerabilities. They're going to exist in different proportions. The third step is to assess your current controls. So what are you currently doing to mitigate the effect of these threats and vulnerabilities that you've identified? How are you securing the value of your assets? How are you maintaining the security of your protected health information? Are they effective, or are there areas where you need to improve? So step 4, to help understand the effectiveness of the controls, is determine the likelihood of threat occurrence. There are threats, they exist. Some are more likely than others. And you also want to analyze the impact to the organization in terms of if a threat were to occur or a vulnerability were to be exploited, what is the impact to that organization? This relates to the criticality of the asset that would potentially be compromised. If you lose one workstation versus losing your server or your backup drives, very different impact there. So using the likelihood and impact, you determine the level of risk, and this should be a risk that is facing the different types of assets that you have in place. And from this point forward, you can implement or improve the security controls that you have in place to better manage the risks facing your organization. The final step is sort of circular, ongoing risk management program and recurring SRA review. So not only should the SRA process be repeated with some regularity, industry standard would be annually, at least annually. There is also ongoing risk management that is a continuous process. And of course, with all steps, you need to document everything. and especially when it pertains to your HIPAA security rule program. And then again, make sure you are maintaining that documentation, supporting your risk assessments and your risk management activities for at least 7 years. So let's say you're ready to conduct your security risk assessment with the goal of using it to attest to meaningful use. What do you need to know to make sure you can attest? Based on the most recent CMS guidance, the security risk assessment must take place no earlier than the start of the EHR reporting year and no later than the provider attestation date. You should also be assessing your certified EHR technology, so make sure that it is installed and operational prior to conducting the risk assessment. You also need to conduct the risk assessment for each reporting year of attestation prior to attestation. And it should be noted as well that it has to happen during the calendar year of your reporting period. So even if you plan to attest in February of 2017 for 2016, you need to conduct the risk assessment prior to the end of 2016 in order to meet the requirement. An important note is that risks identified in the risk assessment do not need to be addressed prior to attesting to meaningful use for the year of that risk assessment. However, you do need to mitigate the risks identified, and meaningful use audits often look at multiple years of data. So be absolutely sure you have documentation to demonstrate that corrective actions have been taken to mitigate previously identified risks, and you want to make sure that that documentation is clear, concise, and of course accurate. A commonly asked question is, how often does a practice or provider need to complete a security risk assessment? If you're participating in meaningful use, you need to do one every year for which you're attesting to meaningful use. Also, you should update your risk assessment every time you have major changes to your IT infrastructure. For example, if you change your EHR vendors, or if you install new IT equipment such as upgrade your server operating system, or install new firewall, install new workstations. Immediately following such an upgrade, you should update your risk assessment to account for the changes in your infrastructure within a reasonable and appropriate time frame, of course. If you're not participating in meaningful use, HIPAA does not prescribe a specific frequency for conducting risk assessments, but the recommendation is at least annually, and that's pretty standard across the board. But it's also important to note, and the meaningful use language makes note of this, risk management and assessment, it's a continuous process. I've said it before, I'll say it again. Make sure you have documentation to support your ongoing risk assessment and management process, because these requirements are beyond meaningful use. They're also beyond HIPAA requirements. It's really crucial to secure your patient data beyond these requirements. You may find your organization is equipped with the resources to perform a security risk assessment on its own, but if you're not sure and CETA is able to assist, our security risk assessment service and toolkit is based on NIST guidelines as well as the security rule itself, and our guidelines for security risk assessments and security rule implementation are referenced there, 800-30R1 and 800-66. If you don't want to read through those yourself, you can certainly talk to us about what those documents contain. You can certainly work with us as an NCETA customer. Our experts will work on site with practice leadership through the SRA process. Every step of the way will help you identify your assets. We will help to identify threats and vulnerabilities, and discuss and evaluate your current control measures. Ultimately delivering an analysis, a recommended plan of action, and tools to improve security and compliance. And that's really crucial for the ongoing aspect of the security risk assessment, is making sure that you have the right context when you're completing this process, and that you have an organized plan of action going forward. Here's a screenshot of our risk assessment tool, developed in collaboration with security experts from the nationwide network of regional extension centers. The tool thoroughly examines all requirements of the security rule for your practice. It uses determinations of likelihood and impact to calculate a risk level for each asset vulnerability. There are many other tools available online, including some do-it-yourself resources. And while these can be very helpful, and there is certainly no single valid way to perform risk assessments, a crucial consideration that you should have is, does your practice have the expertise and resources available to properly utilize these tools and conduct an accurate and thorough risk assessment on your own? Some organizations do, but even for them it's valuable to have the perspective of a dedicated security consultant right at your side to advise on the meaningful completion of a risk assessment. Here's another screenshot, some of our policy templates from our toolkit that are customizable to your practice. These will be provided to assist in ongoing risk management program. Many of our smaller clients do not have the policy documentation in place, and the administrative work required to put these in place can be a burden. So we've put together policy templates. There are also other resources that are part of our process, including a very neatly organized corrective action plan, educational tools, and other resources regarding encryption, disk wiping, all to help increase and improve your security. While there's no one-size-fits-all solution to security, there are still best practice considerations that are generally applicable to practices across the board. The best way to prevent an OCR HIPAA audit or investigation is to prevent a breach in the first place. So think of information security as an investment in your business. All of your stakeholders benefit, from ownership to patients to employees, when an organization keeps its protected health information secure. You want to make sure staff are educated and aware of security requirements, including HIPAA requirements, as well as your internal policies and procedures. They are the front line of prevention, and it's important for a culture of security awareness to be established by these reasonable and appropriate safeguards being in place, being enforced and practiced consistently at all levels of the organization. It should include management, it should include the providers, as well as ownership. You want to make sure that your risk management process is self-reflective. You want to assess risks and your remediation of risks. Examine the effectiveness of your policies and procedures and how they might be improved. This should be a regular part of your risk management program. Finally, of course, treat your business associates as if they were insiders. The same expectations you have of your personnel, you should be satisfied that those expectations are being met by your third-party vendors who have access to your protected health information. Now, while you cannot exercise the same degree of control over their behavior as you can over members of your own workforce, you can be confident in your trust in them by getting the information you need to assure you of their sound security posture and safeguards. At the end of the day, no one wants to be a security guard asleep at the post. Other important considerations are that even if you are compliant, it doesn't mean you can't suffer a breach. So I would urge caution in any audit preparation or risk assessment activity that promises to give you a stamp of compliance. Such a stamp or exercise would be at best a snapshot of your compliance status at a single point in time, and it's really not a guarantee that's going to be sustainable. Also, a very important note is that audits are subjective. While the OCR does have their audit protocol posted for public review, exactly how that language is interpreted, it's always being interpreted by human beings, and so there's really no way to guarantee how any of this language or process is going to be interpreted. So you want to focus on critical assets and protecting your EPHI. Your security risk assessment will help you prioritize risks, but it's ultimately up to you to take security and risk seriously. Security risk assessments should become a routine part of operations. Integrate the results into your normal day-to-day decision-making. You want to formally designate a security officer and involve them in major decision-making. Ideally, the security officer would be someone who is already an established part of your management team, and in general, the higher level of authority the security officer possesses, that's often an asset, because a culture of security starts at the top and trickles down to everybody else. So once again, risk can never be eliminated. You need to reduce it to a reasonable and appropriate level. Completing a risk assessment for meaningful use does not necessarily mean that you're compliant with all aspects of the HIPAA security rule, though an accurate and thorough risk assessment for meaningful use that is effectively meeting the requirements will consider all aspects of the security rule. One thing you need to consider is, does your risk assessment process address all of the security rule requirements and implementation specifications? Does it include all of your electronic health information? So some final thoughts. Security risk assessments are required for compliance with HIPAA and meaningful use. Risk and regulatory oversight have been increasing and are expected to continue to increase. Practices are expected to take security seriously and put forth a good faith effort. Again, reasonable and appropriate safeguards need to be in place, and your security risk assessment exercise should be a meaningful part that the results of which are integrated into your organization's operations. What's required to do this effectively is hard work, diligence, and very importantly, integrity. An SRA is the first step of a continuous, comprehensive risk management program that will benefit your patients and your practice. So once again, you don't want to be the guard asleep at the post. And normally, I kind of get hung up on the inappropriate use of quotation marks in signage and documentation, but in this particular instance, they would appear to be very appropriate. So these are some quality resources for further reading. In the PDF version of these slides, you will find that these hyperlinks will lead you to the described resources here, including CMS tip sheets, most recently updated in March of this year. NIST special publications. ONC has put out a very nice guide to privacy and security of health information. You can also look at OCR resources, including the Wall of Shame and the audit protocol, which are on the internet. And finally, final guidance on risk analysis as described by the Department of Health and Human Services, and the HIPAA administrative simplification, which includes the security rule, privacy rule, and breach notification rule. These are all available for free download through their official sources here, linked here. So at this point, we'll just open it up for any questions you might have. Thank you for attending.
We did have one question come in during the presentation. How do we put encryption in place?
All right, good question. There are a number of resources available, and it also depends on whether you're referring to encryption at rest or in transit. So encryption at rest, for a computer hard drive, it's pretty standard these days for operating systems to come with encryption. It just needs to be activated. But of course, it's an important procedural consideration to make sure that encryption is going to be activated through effective screen locking and logging out of your active sessions when using those workstations. Even after you've encrypted the device, once your encryption is open, it stays open until you close it again. So that's one way that encryption can be bypassed for encryption at rest. There are other commercial products in addition to the standard the standard encryption tools that are generally included in Windows and Mac operating systems these days. But when you're talking about encryption in transit, you are talking more about, for example, a secure connection on the internet through OpenSSL. Most websites for your EHR portals, for example, are going to be secured through an encrypted channel. But for remote access, if you're not going to be accessing the EHR in a protected network, you want to secure the connection using a VPN or a similar encryption tool, which basically encrypts the data that's being transferred by creating a secure shell of indecipherable information around it. So at a high level, that is how you would apply encryption. And I hope that answers your question.
Okay.
If it does not, feel free to reach out to me, and we can kind of expand upon the conversation.
Okay, well, it is now after 1 o'clock, and we have kept you past our allotted time. So if you did ask a question and we did not get an answer to you, we will email you directly with an answer following this broadcast. As a reminder, we are posting this presentation and a recording on our website, www.mceta.org. Hover on the Resources tab and then select Webinars. With that, we will let everyone go. Everyone have a great day.